Hey, Dr. Lindsey and Wendy, we're going to talk to you about a kind of a serious topic now. In this month's issue of the Hair Transplant Forum, which I think anybody can look at online, but it comes out to, I guess, most hair transplant doctors on page 77, news you should know, malpractice lawsuit involving delegation of FUE. And the reason why this is important is that we hear from a fair number of patients in our area and coming in from other areas that they go to somebody that has recently got into hair and that they show up and the doctor's there for maybe the drawing of the plan and probably the numbing up and certainly the collecting of the dollar, and then that's all they see.
Well, there's a lot of our patients that say that the doctor doesn't even numb up. It's the technicians to numb up.
And that is not allowed, at least in the state of Virginia, unless that technician is a certified medical, I don't know, probably a nurse practitioner or a PA. And so if that's happened to you, then, and you're in the state of Virginia, I would just call the Board of Medicine. We've had a number of patients that we've told them to call the Board of Medicine when they tell us stuff like that, because we're not the cops. We're just here to help if there's trouble with getting another hair transplant. So in this, essentially the bottom line with this is it was out in the West Coast, and it sounds like that's exactly what happened. The patient visited a doctor's office, and he got an automated FUE procedure, and the entire surgery was assigned to some technicians that weren't employees of the doctors, that just travel techs, and I guess the patient had less than satisfactory growth, which probably isn't from those techs, but rather from the technique that they used. But still, it highlights if you're getting a hair transplant or any kind of surgery, your relationship's with the doctor, not with whoever he's got working there. And granted, Wendy and I do these cases together, and so at this office you spend as much time, if not more, with Wendy than me. But I mean, in there all the time, and making sure things are going correctly. I'm not out doing a breast augmentation or exercising, which certainly I'd like to do, but I'm there with you. I mean, we do. That's why we're here. And so I don't know what advice to tell you, the viewing public, other than when you go to interview potential doctors, make sure that the doctor's the one that's actually doing the surgery, and the best way to do that is to see a case going on. So when we have consultations, we try to set them up on times when you, the viewing public, can come in and see how we do a case, so that you know exactly my role and Wendy's role and all the cutters and the other placers' role, and you get to see a patient in the chair. And so sometimes you get on me because I don't want to do consultations at 4 in the afternoon because we're done with the case. I think you, the viewing public, should have the opportunity to see a case going on. Don't you?
Yes. So when you say, that I think it's for you to, the patient to ask, what is your role as a doctor in the procedure? Because when it comes to hair transplants, it's hard
a lot of it's
for the
delegating.
doctor. Delegating, exactly. Like that's what you come and you eat your oranges, you eat your apples, and you're just right there on top most of the time.
Right, yeah.
And it's like...
And certainly this office, I'm in charge of all the drawing, all the consenting, all the numbing, all the cutting, all the sewing, all the hole making, and then quality control.
Yeah, and then, and that's, when they come in, you're back and forth, looking at, what the cutters are doing and what I'm doing, talking to the patient, making sure that, that he's comfortable.
Yeah.
Numbing up, he's the only one that touches anything that's sharp.
Yeah.
To work, and then that's the only thing, and some other places, I think they have, 90% of the technicians do numb up their patients.
And that is not allowed in the state of Virginia, and probably a lot of other states. So if you're looking out or if you're trying to do research in a hair transplant, go see a case going on and ask pertinent questions to all the doctors you're interviewing with. If you've had a hair transplant and you think something's been irregular, well, talk to the Board of Medicine in your state. That's what their job is to look into these irregularities when you never see the doctor. And if we can help you, please give us a call. Thanks.